Radio Doctor, your free phone-in health consultation program. Every Thursday brings you medical experts in elderly health.
The elderly, they are peculiar. Their body system is actually changing. They are becoming like a newborn baby in the sense that their immunity wanes and dwindles. So when it's cold, especially in the mornings, in those areas that it's really cold, I'll advise that they use warm water.
Call in to get free consultation on elderly health on 07000 917 917 and 090 256
They asked me to give him 5 minutes. I'm trying to call you.
Contributions on social media, Facebook, Twitter, and Instagram at WFM917. Text and WhatsApp to 0703 175 6537. You can listen live online on www.wfm917.com. Radio Doctor, Nigeria's first free consultation radio health program on WFM 91.7.
That doctor for tomorrow sent me a message that she can only do once a month.
On Facebook, they're on Facebook Live, they're on YouTube. Let me see. You have Instagram?
Like, no, Instagram is like,
Okay, so you're on Facebook and on YouTube. No. See, Facebook, YouTube.
look, you should pick now, please. Hello, Dr. Tony. Yes, are you ready now? Sorry, Dr. Tony, sorry. You know that if it was when Daniel was there, now Daniel knows how to talk to you like this. You've run away from me. So it's today that I'm able to have you on, please. All right, Dr. Tony, please. Are you ready? Yes, sir. Daniel did not do what? Daniel is no longer with us. Don't worry, we'll talk about that at the program.
Yes, indeed. If you want to live long and stay strong, make sure you take your health very, very seriously. Consider your health and make sure you take good care of yourself. The program you're still listening to is Radio Doctor 91.7. Radio Doctor is a free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's health program on Women Radio WFM 91.7, broadcast weekdays from 10 a.m. to 11 a.m. And each day is dedicated to a medical specialty with an expert to offer consultation and advice. I do have a medical expert on the program with me this morning. And the expert I'm talking about is Dr. Tony Olanwaju, the general practitioner. Good morning, sir. Good morning, Dr. Tony.
Good morning.
How are you doing this morning?
Everybody doing good.
It's nice to have you on the program. Thanks so much for joining us.
You're welcome.
Thank you.
Thanks for having me.
Yeah, so we're going to be talking about arthritis this morning, and we'd love to hear your thoughts on arthritis. So, can we just start with what is arthritis exactly?
So, in medicine, anything that ends with IS means inflammation.
Okay.
So, when we're talking about arthritis, inflammation of the joint, I don't want to go into the way where we get joint from arthritis, but don't forget it.
Okay.
Arthritis is just the inflammation of the joint, and it can affect one joint or multiple joints. It's also very common among elderly, and there are so many types. There are like 100 types of arthritis, which can affect every joint in the body. And we all know what a joint is, right?
Yes.
A joint is a point where two bones meet, and we have over 200 bones in our body. So just imagine how many places can be affected by arthritis in our body.
Thank you. Now, people usually think that once you get to that advanced age, once you become elderly, that it's a given that you have to have you at some point you would have arthritis. Is that the case?
Yeah, so arthritis is common in the elderly because
Okay.
of wear and tear. Wear and tear. When you use something all the time, for example, the vehicle,
Yes.
keep using it and you don't do it well. After a while, you start hearing noises, especially in the leg and the tire side. You need to lubricate it. If you don't, it's gonna tear and it's gonna destroy, and it's not gonna move well.
Hmm.
Likewise, our body is like a machine.
Okay.
Our body is a machine. We have so many contacts with different parts of the body, especially the bones, which if we keep using it especially vigorous, it could that could lead to wear and tear, where the meat and eventually arthritis is going to set in
Yes.
because there's no space. We're going to talk about the joints, what makes them I mean to function. There's a space where there is a fluid called the synovial fluid, and the plan is for this bones not to meet. So the bones and the joint are not supposed to fully meet. They're surrounded by cartilage too. So after a while, if you live long or if you do a job that is too vigorous, the space will start narrowing. There'll be narrowing of the space,
Yes.
and they could eventually meet. And when they meet, it can lead to three things. There are three major things that we witness when they meet. The first thing, if they meet, pain, the person will feel some pain. The second thing is there's stiffness, that joint because of the lubrication, the lubricant,
Yes.
not good anymore. The person can't move that part of the body well.
Okay.
And then finally, there is swelling. So it's a form of swelling around the place because of inflammation, and there is difficulty in function of that joint. So
Yes.
the person can perform the same function or range of function
Okay.
of a particular part of the body. That is classic presentation of arthritis.
So those are the symptoms of arthritis.
Yes, that is basic symptoms, the common symptoms. But there are other ones. Sometimes you hear this popping sound. And this popping sound. There is
Okay.
this also there could be some fever. Because sometimes it's warmer. So if you touch part that is inflamed, warmer than the other part.
Okay.
And there are other symptoms that may be associated with other diseases that are um, not really primarily arthritis, because we have different types of arthritis. I know we're going to get there.
Yes.
But if you have some types of arthritis, there are other presentations, other symptoms that you will show, apart from the symptoms that are just specific to the joint and presentation.
Okay. So could you please just go ahead and let us know the various types of arthritis that are present currently?
So the most common type is called osteoarthritis. Osteoarthritis.
Okay.
And this is usually due to wear and tear. It is generally common, especially among the elderly. And it's fairly common in our environment, especially if you are someone that walk a lot. So the joints that are affected most are the leg joints. So we have the knee and the ankle, also sometimes the waist too, but more common among the knee joints.
Okay.
And then it might not be symmetrical. When we say something is symmetrical, it means, we have two nails. So one of them might be more inflamed than the other, or one of them might not have any inflammation, might not have arthritis, but the other one has. So say it's not symmetrical.
Okay.
But for rheumatoid arthritis, which is the second most common, rheumatoid arthritis, it is due to autoimmune disease. Autoimmune disease. I mean, something is autoimmune. You know what it means? It means that the body is fighting itself.
Okay.
Because of the immune system, a problem in the immune system. So instead of it to protect you, it is fighting you. And in rheumatoid arthritis, it's not just the joint might fight. I mean, it fights the joint, but you will see other presentations that the person will also have. The person will have fatigue. You might have some anemia. But there will be problem with the joint, and it's usually symmetrical. I mean, both joints will be affected. If the right side of the body affected, the left side will be affected.
Yes.
And it is more difficult to treat. You have to treat the immune problem and not just focus on the joint problem for you to get the person back to order. So those are the two major types. But apart from that, there are so many types. I mentioned earlier, there are like over 100 types.
Yes.
We have gout, which affects the food. We have lupus. Lupus also is autoimmune. We have some type of reactive arthritis. There's so many. So reactive, there are so many. I don't want to bore with that.
Yes.
We have so many, but the common types are rheumatoid arthritis and osteoarthritis.
Okay, thank you very much for your response. Let's move on now to the treatment of arthritis. Is there really a cure for arthritis, or it's not curable?
I mean, what did you ask?
I said, is it curable? Is arthritis curable?
So it's manageable.
Okay.
So it's manageable.
Okay.
And I said there are so many types. So
yes.
There are some that you get to the stage of saying, okay, gone. But for the ones that are common,
yes,
the rheumatoid and the osteoarthritis, it is due to long-term problems. So you normally manage it, a chronic condition,
okay,
and we just manage it. And we have different ways of managing the arthritis.
Okay. All right. Thank you very much. Also, we'd like to know if, when it comes to arthritis, are there any specific factors that can make arthritis worse?
Yes, that's very true. Okay. So there are what we call risk factors. If your body mass is a higher level, you're obese, you're overweight, you're putting more pressure on your joints.
Yes.
So that's going to lead to it, for you to get a lot of wear and tear, and it gets arthritis easily, And then if you're also someone that is older, and you mentioned that,
Yes.
And then if you had a previous history of an injury or accident, to any of the joints or bones, it could also affect the normal structural architecture which could predispose you to arthritis. And we have people genetically, they have this familiar history. So their grandfather had arthritis, so it's more likely that you're going to get arthritis. And this usually occurs most of the time in the rheumatoid type. So you have family history too. And then there are some medical conditions that cause muscle weakness, that if you have them, it also expose you to arthritis. These are the main causes.
Okay, thank you very much. Now, how can arthritis is it possible for it to be prevented, or it's more or less like something that will come up once you get advanced in age or when you become elderly? Can it be prevented in any way?
Yes. Especially if you don't have any of these things I mentioned earlier.
Okay.
If I've said it, okay, if you're obese, to prevent it, what do you need to do? To reduce your weight.
Yes.
So the right form of exercise. Actually, the problem of wear and tear most of the time, especially for the osteo.
Yes.
So if you are doing moderate intensity exercise, the bones are in the right tone, your muscles right tone, you're not overbearing it with too much weight,
Okay.
then you won't get arthritis, Then another thing you need to do is your diet. What you eat. You eat well. You eat a well-balanced diet. You're helping your joints too. You have to avoid crashing your diet or fasting. You can fast, but let it be moderate. You do the right things when you're fasting. Make sure you're well hydrated. I told you that there's a fluid around the joint called synovial fluid. It's made up of that water. So if you're hydrated, your joints will do good. And then you can also take calcium, the dietary calcium. So you take food rich in calcium. We have biscuit bone you can take. You can even supplement calcium. You do this for every pregnant woman because when they are pregnant, the baby is developing structures.
Yes.
And then you have to take from their stores. So we need to supplement them. But even as you grow older, your stores are depleted. Our what do you call it? Our crops and our diet, they are not getting enough. From them. So we can take some calcium supplement or supplements specific for your age, which would help you and reduce your risk for what we call osteoporosis.
Okay.
Later in life, And then I say you shouldn't drink. You drink enough water, but you shouldn't take too much alcohol. All the things react in the body. So instead of taking alcohol, take non-alcoholic fruit juice. They have more vitamin D.
Okay.
Very good for the bone. Exposure to sunlight. You get vitamin D from the sun, from sunlight. So you don't just stay indoor all the time. Take a good walk down the road daily. So helping you use the joint and keep it healthy. And make sure you moderate your weight. I mentioned that too. Make sure you have a good weight. So your BMI should be between 19 and 24.9. Once you're above 25, 18.5 and 24.9. But once you're above 25, the body mass index, and that's the ratio of your weight and your height. So the weight of height squared.
Okay.
So when you do that calculation, it should be between 18.5 and 24.9. If you're within that range, you are good to go. So these are the things you can start doing, to prevent arthritis.
Okay.
I know most of us are not smoking, So, but if you are, you have to stop smoking. It's like inflammation. You're like burning inflammation, like something is burning. So when you smoke, you are burning parts of the joint. And there are some diets like diets that are very rich in milk, and actually animal-based milk. If you know that you have any of these challenges with your joint already, you have to cut down on taking too much milk, too much carbohydrates. things that are really good. If you go all the diet, you exercise, you rest adequately, you're on the path to an arthritis-free life at the age, especially if you don't have a family history.
Okay. Thank you very much. You're listening to Radio Doctor on 91.7, your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized radio health program on Women Radio WFM 91.7, broadcast from 10 a.m. to 11 a.m. Mondays through Fridays. And our doctor for today is Dr. Tony Olariwaju, a general practitioner. And he's been doing very, very well explaining to us what arthritis is and everything that we need to know about arthritis. Thank you so much for being on the program with us this morning. Yes, if you do want to call in and ask a question, please feel free to do that. The number to call is 07000 917 917, 07000 917 917, or you can send a text or WhatsApp message to 070 317 565 37. If you have a question, please go ahead and call in, or you can send a text or WhatsApp message to 070 317 565 37. Even if you don't have questions on this topic, arthritis, we do have a call coming in. Hello? Hello?
Good morning.
Yes, good morning. What's your name, please? Where are you calling from?
My name is Festival.
Okay, nice to have you calling. Please go ahead. Calling from where? Agbado, nice to have you. Please go ahead. Okay. 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 All right. Thank you for your call and your question. All right. The doctor will answer you now. Okay. Thank you. All right, Dr. Twain.
Yes, I didn't hear what she said.
Yes.
Yeah,
sure. Yes, I'll repeat what he said. He said that from his legs upwards, he feels this pepperish sensation, and that he was told that he has inflammatory arthritis. And also says that he has joint pain as well, but the joint pain is not that much. That what can he do about it?
Okay, so I already mentioned some ways to manage arthritis.
Okay.
So which of these legs, which what leg? So we have to first know which type. So I told you if you have the autoimmune type, you need to treat it centrally. Hello, good morning.
Yeah, I'm so sorry. We have another call coming in right now, so maybe we just answer the questions. Hello, good morning.
Good morning.
Yes, good morning. What's your name, please? Where are you calling from?
My name is Trinidad. I'm calling from Nigeria.
Okay, thank you for calling in. Go ahead, please.
Yeah, I just wanted to ask doctor if the arthritis is commonly happens to the arm or so.
Okay. If it's commonly.
Because I actually have an injury. I have a dislocation on my arm, my shoulder. So
Okay.
it's been affecting me for a very long time.
Okay.
To
the arms. Okay.
Yeah.
Okay. Thank you for calling in. Thank you. All right. Sorry, doctor. We just had another call come in, so maybe you can just finish off with the first one, and then you can answer this next question. Let me just tell you the next question, Dr. Twain. Okay, so the person that called in now said that he has, first of all, his question is, does arthritis commonly happen, on the arms? And he said he also has a dislocation around his arm and shoulders. But he wants to know that, does it really happen around the arms? Is it common around the arms when it comes to arthritis? So that is his question.
Okay, so like answer the first one and second one.
You can answer both. You can answer both together.
Okay.
Yes.
So how do you manage arthritis? He said that he has this pepperish sensation.
Yes.
But problem moving that joint.
Mm.
So if he has if it obese, you should try to reduce the weight. That's the
Okay.
first thing you should do.
Okay.
Try to reduce the weight, and then you should exercise like I said earlier on. But there are two specific exercises that you should do. You shouldn't just go and start lifting so many weights and putting more pressure on them as well. If it goes to YouTube and people's exercise,
Okay.
they can get a phototherapy, a physiotherapist.
Physiotherapist.
They
Okay.
get a physiotherapist.
Okay.
They will tell him what to do.
Okay.
Get them joints relieved of the pain and all that.
Okay.
Now, there are other things you can do, especially in the chronic pain. If you have a chronic pain, that's a pain that's been there for 3 people. You can put compression. You know that they have good compression,
Okay.
or we have good compression. So you just tell people listening to me when you use hot or cold compression. And if the problem, the joint problem, you hit your elbow, you hit your leg somewhere, you have an acute problem, it just happened to you now. You can use cold. What you do is cold within 48 hours. You use cold to reduce the swelling, to reduce the inflammation, because it will be hard, it will be swollen. So you get ice block, ice pack, you put it there. It's going to help you relieve the pain and the inflammation.
Okay.
But if the pain has been there for a long while, it's been there for months, you can try warm compression. So you get a towel and all that, you make it warm, but so you put it around there. That one is going to help the vessels to send blood, to dilate the vessels, so blood is going to go there to heal the problem, to solve the challenge. So that's when you use hot or cold compression. That's something this man can try, and you should also try to eat the right diet. He said his leg is pepper. Maybe God is telling him to reduce pepper,
Okay.
But honestly, you notice that there are some foods that makes it difficult to treat arthritis. If you have arthritis and you're taking those type of food, for example, separate meal, I mentioned dairy, like milk, very the lactose intolerance, gluten-rich milk. As much as you can, try to take a lot of fruit and vegetables, because they have multivitamins, they have vitamins, they have minerals, go to the joints and make them strong and good.
Okay.
So that's what I'm going to advise them to do. It does all these things. If it's perceived, you have to treat with medication. So we have medications for pain, we have medications for sweating, we have drugs for all of them, but we don't always want to bombard you with a lot of medication, because medication has side effects.
Yes.
So we always try to do all this stuff, and then we give some medication. We even have injections that we can inject into the joint spaces. Steroid injection.
Okay.
But we don't. We have a grade. We have a way we choose which to give at a particular time. Well, we don't just jump to injection. So we start with medication, NSAID, painkiller.
Okay.
If that doesn't work, we could add other modulators. Then later we move to steroids and injection. Then once we are able to go through this route, we get the patient some relief and his life back.
Okay.
So this is a summary of the treatment of arthritis. The last option is surgery. Yeah, surgery, because we have to sometimes go and clean up this and then make sure they are well of course. Because even with a replacement, so we can replace the joint. In the medical world now.
Okay.
Very soon we are going to see people who want to be able to do robotic hands, even replace the old arm, not just the joint. With how far medicine is going.
Okay.
Now, for the second question about the arm,
Yes.
usually they always like you to come to us as soon as the problem happens, especially for dislocation.
Yes.
The treatment is just to dislocate something, relocate it, put it back in the joint space. It's different from arthritis. So when you have a dislocation, it's pretty good to do a small maneuver and then get the joint back to the space. Or even if it's prolonged, we can still go to the hospital and they can do that. But arthritis is not that common in the arm. It's common on the leg, and it depends on the type of arthritis. So when you talk about the arm, you mean the fingers, because if you're talking about the fingers, arthritis is common in the fingers. But if it's the elbow joint or the shoulder, very uncommon
Okay.
to have arthritis there. But fingers, very common, especially the rheumatoid type of arthritis.
Mm.
And we use our hands a lot. We use our hands a lot to do things.
Yes, yes,
So,
yes.
so I told you, osteoarthritis is because of what? Wear and tear. So any joint that you use a lot, like the fingers, the knee joint, those are the common ones because those are the ones we use most of the time.
Okay.
That's where you see a lot of osteoarthritis.
Okay. Thank you very much. Now you're still listening to the Radio Doctor on WFM 91.7. The Radio Doctor on Women Radio, WFM 91.7. Radio Doctor is your free health consultation program where real doctors advise real people. I was just curious, Doctor, is it possible for young people to have arthritis?
Yes, we even have one that we call juvenile arthritis.
Okay.
Juvenile is young. So it's young, it's common. And then there are some conditions, that is responsible to arthritis. I mentioned some earlier, even sickle cell disease, there are some conditions that if you have your joints, your bones are not strong, so they can easily get disease, so if you have those conditions
Okay.
as a child or a young person,
Yes.
you can have arthritis. But it's a disease of the elderly.
Thank you. We did have a call coming in. Good morning. What is your name, please? Where are you calling from? Okay, nice to hear from you. Please go ahead.
Yeah, I want to ask the doctor on behalf of my mom. My mom is aging, but she complained. I know she has arthritis before. She's a complaint of arthritis. Presently, she has a both legs swollen. So sometimes she said she doesn't know where to place the leg on the floor. So most times when she places the leg on the floor, she feels pain or she feels that. And then sometimes she doesn't know. Sometimes she tries to lift her leg up so that to see the pain can subside. And she's this kind of person that she's she has sort of weight, especially on her hips.
Okay.
On her hips.
Okay.
So I don't know. Someone was saying, my brother was saying that it's a sign of heart failure. I don't know.
A sign of heart failure.
What can the doctor advise us? Carry on that swollen leg. How can we, solve the problem with the swollen leg? I'm trying to take some things.
Okay.
Carbohydrates and things like that. I don't know if it's overweight that is causing it. How can we reduce the swelling of the leg? And I don't know, what should she do? Both legs are really swollen.
Both legs are swollen. Okay. All right. Thank you very much for your call. Thank you. The doctor will answer your question now. Thank you. Yes. Hello, doctor.
Hello.
Yes, the caller that just called in said that his mom has swollen legs. Her legs are very swollen, and it's very painful as well. And it also says that another thing that his mother has a lot of weight on her hips as well, and they were telling them that it could also be a sign of heart failure, and that is asking what can be done about it.
So leg swelling. Now, what are the causes of leg swelling? And which type of swelling does the mother have? And where is the swelling? These are the questions I would love to ask. Now, legs can swell because of, I've mentioned this on the show before.
Yes.
Not just like any part of the body can swell because of 5 major things. I'm calling the 5 M's. It could be because of what? Fat. F-A-T. That place could have a lot of fat. Number 2, it could be because of fluid. F-L-U-I-D. Fluid. And how do you know if it is fatty, the control of fat, or because of fluid? You will touch it. When you touch the leg, this teaching is something called Peter edema. When the person touches the mother's leg, especially around the ankle, does it depress? Does it go down? If it leads to a depression and then later after a while just comes back, it is because of water fluid that is there. So it's a Peter edema. Swollen leg because of leg. And this is due to heart failure or kidney problems. So when she said my mother, I need number one, the one is elderly. Said leg. I think my mind, I'll say this is lower leg. This is the lower leg and it's fitting. Most likely heart failure. This is different from the swelling that you have in arthritis. Arthritis, when you press the leg, it doesn't go down, it doesn't depress. So I don't want to talk about the other ends because they might not be associated with the legs, but for other things that cause swelling air, fluid, another thing that can cause swelling is heat, and it's tumor, something like fibroid, so it's tumor. But in case of your mom, I would say I'm suspecting if it is pitching, it's because of maybe she has water or fluid around her leg, and this could be because of what? The heart failure. So she needs to take her medication. And then for us to remove that fluid, we need to take our medications we give you. And once you take it, you want to urinate the fluid out, and the mother will get some relief because her legs will also be around the lungs.
Okay.
And she won't be able to breathe well.
So
look at these things. I like radio doctor. I think the radio doctor is just to give you, a tip and then tell you what to do. But most of the time, he cannot see you. He cannot feel you. So he cannot give you the full picture. We don't have the full picture. So we can sometimes give the concise diagnosis. So I would say she should still take her mom to the doctor and let the person still and treat her.
So what kind of doctor would you recommend that they go to see?
All right, so we have geriatric doctor. So it's a mother of elderly.
Yes.
Yeah, so she has doctors for the elderly, geriatric doctor. But even after that, if she has any condition, general practitioner can come to, and then he is gonna refer to whichever specialist she might need to see.
Okay. All right. Thank you very much. Are you still listening to the Radio Doctor on WFM 91.7? The Radio Doctor on WFM 91.7 is 60 minutes to 11. We're still accepting your calls or your text messages. If you have a question for the doctor concerning arthritis or just general health questions, please go ahead and call in on 07000 917 917 07000 917 917. You can call in on 07000 917 917 07000 917 917 or send a text or WhatsApp message to 090 070 317 56537 070 317 56537. The doctor on the program this morning is Dr. Tony Olariwaju. Thank you again for being on the program with us this morning, doctor.
Good morning.
Yes. Are there any other information you can give those that have arthritis, especially when it comes to the management of arthritis? Is there any other tips you can give for those that are suffering from arthritis right now?
All right. So I'm just saying that the earlier you know what you are, the easier it is for you to do it.
Okay.
The problem knows already have solved. So you need to know the early warning signs of arthritis and prevent it from becoming so bad that we need to take you for a replacement. So what are the early warning signs of arthritis? First thing you might start feeling some pain in the joints, and some stiffness. I said that earlier on.
Yes.
Stiffness and then some weakness. And then sometimes you hear this pop sound. I just add some now first when I did my hand. I think I also need to take more water. Yes, so look at the early signs. So don't ignore those things. Once you start noticing all those signs, start eating well. Reduce your consumption of fatty foods. Reduce your consumption of sweet carbohydrates. Take more fluid. Eat well, rest, exercise. Get your body back balanced. And make sure you reduce your weight if you're on the big side.
Yes.
So I think the earlier you notice your things and the earlier you get it treated or get it managed, it's better for everyone. That's going to be my take home and word, my final one.
Yes. Before you finally wrap up, Dr. Tony, I just want you to just bust one of the myths surrounding arthritis. Is it true that people with arthritis should not exercise?
Wow. So that is false. Because because there are different types of exercise.
Okay.
In fact, there are people that have arthritis that should exercise.
We have a call. We have a call coming in. Sorry about that. We have a call coming in. Hello. 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 Okay, we lost that. Yes. Good morning. What's your name, please? Where are you calling from? Agbado. Your name, please. Jerry. Nice to have you on the program. Please go ahead. Thank you. Waste. Okay. Okay. Okay.
So it has taken some quite long now.
Hmm.
And I've been taking some medication, but all the time it normally comes back.
Hmm.
When I went to the doctor, they said I don't even X-ray. They said it's arthritis.
Okay.
But now the medication I'm taking is much. So I
Okay.
don't know what else to do.
Okay. Okay. All right.
I am on age of about 65 years.
65. Okay. All right.
Yes.
Thank you.
Trying to reduce
Okay.
my weight because the pain is still coming.
Okay. Okay. Thank you so much for calling in. Appreciate the call. So the doctor will answer your question now. Okay. Thank you. Thank you, Mr. Jerry. All right. Hello, Dr. Toyin.
Hello.
Yes, the question from Mr. Jerry, his question is, he said he has a problem with his waist, and he said his hip bone is painful on the right side, and he said it's been going on for a very, very long time now. And he said he's on a lot of medications currently. That when he went to the doctor, they said that he has arthritis. And he said he's taking lots of medications, but it just keeps coming back. He's 65 years old. The same thing keeps happening. He keeps feeling the pain. It keeps coming back, and he's on a lot of medications right now. He's asking what can he do.
Okay, so I usually don't like jumping to medication. I would love to ask them that did they do investigations? You know, did they do an X-ray or fix an MRI of that part? You know, when something is persistent, you need to look at it, like I said.
Yes.
So there are investigations that can be done to know specifically what type of problem is going on there. So you need to do an imaging investigation. And then
Okay.
there are other types of investigations. Okay, since this is not going to the normal med, could it be something like systemic? Could it be an autoimmune disease like I mentioned earlier? Something else is going on there.
Okay.
So there are other tests for that. We have the rheumatoid factor. We have some antibodies you can check for. You know, these are things that you want to do a full investigation of what could be going on there. Then you move on to treatment. So I would like to tell you that you can try some other exercise. This answers the other question
Yes.
that they asked about, you know, can we do exercise if you have arthritis? Yes. You know, but there are some specific exercises for people with arthritis. And some of them include stretching. You know, you can stretch that means flexibility and also stiffness.
Okay.
And that's the range of motion. You know, so there are also some other water exercise, some light exercises, and then a physiotherapist can help you. I mean, formulating an exercise plan for you that could help relieve you. And then some massage. You know, since it could be, you know, the muscle and all the things around the joints, to do some massage and other things that could help you. So I would say you should further investigate that kidney problem and let's see how we can treat it.
Okay. Thank you very much. We do appreciate you for being on the program this morning, Dr. Tony Olariwaju. He's a general practitioner. Yes, Really Doctor is your free health consultation program where real doctors advise real people. If you still want to call in to ask questions, please by all means do that. We just have a few more minutes before we wrap up your program this morning. You go ahead and call in on 07000 917 917, 07000 917 917, or you can send your text or WhatsApp message to 070 317 56537. Have questions for Dr. Tony to answer. It could be on arthritis or it can be a question on your health generally. Yes, we're still talking about arthritis, and Yes, we're still going to go ahead and see if we can get more calls on the program this morning. Hello? Hello?
Good morning.
Yes, good morning. What's your name, please? Where are you calling from?
I'm just calling about
Okay, please go ahead. Yes.
yes. Now, I was saying that she usually complains about not being able to stand
No, maybe
because
it's
of
okay.
yeah, because of
Okay.
the pain from the leg.
Okay.
And so she said that most times when she sits down,
Mm.
she doesn't know how to manipulate to place her leg because of the pain or something that sometimes she usually raise her leg to see if the pain stops.
Mm. Okay.
So I don't know. I think she had that. I think she was complaining about romanticism for a very long time. That
Okay.
even the benefits between romanticism and anxiety and
Okay.
yeah. So I don't know. And then secondly, the doctor talked about BMI, body mass index.
Yes.
I don't know if you can help us repeat that thing. I didn't quite get that. I don't know that.
Okay. Thank you for your call once again. All right, Dr. Tony. Hello.
Yes, hello.
Yes. The person that called in was the one that called in earlier. That talked about her mother having a swollen leg, about her hips being a bit weighty. So she's the one that called back again, and she's saying that the mother has problems standing for too long, and sometimes we try to maybe lift up the leg a little bit to see if the pain will reduce. And she has been saying for quite a while that she has rheumatism. She's wondering if there's a relationship between rheumatism and arthritis. And also, she also would like to get more clarification on the BMI, and if you can help with how they can calculate the BMI. Hello, doctor. Hello.
Yes, hello. Okay, so she said
Yes.
she has some pain in her
Yes.
hip.
Yes.
And the big direction. She didn't answer my question that if the swelling was in the lower leg and if it's fitting.
And she
Now,
did.
for them to be
Yes. Mm.
elevating the leg,
Yes.
you see that the full and it is a fitting edema.
Okay.
So you're trying to get the water out. And then for the whoever advised them to do that,
Okay.
I told them to do that.
Okay.
So I would think that's why.
Mm.
Then the other thing which you mentioned is the fact that the weight, overweight. So BMI, so it's weight over height squared.
Okay.
And I mentioned that for you to be normal, you need to have below 18.5.
Okay.
18.5 to 18.5 to 24.9. Below 18.5 is underweight.
Okay.
And then once you're above 25, you're already overweight.
Okay.
And
Okay.
so it's something that she doesn't even need to do too much mathematics. Just go to your phone or you go to Google, type BMI calculator to tell you what to put in for your height, put in
Okay.
your, and then what to put in for your weight. Once you
Okay.
fill in the space for height and weight, it's going to give you what to do about.
Okay.
I'm going to advise you on how you can go about it.
Okay.
So I would say that's something you should do as soon as possible.
Okay.
But let somebody examine Mama, except
Mm.
and come up with the right and diagnosis for her. And I guess everybody will.
Okay. Well, thank you so much, Dr. Tony, for being on the program this morning. We do appreciate you for all the valuable knowledge you've given out to us this morning.
You're welcome. But she talked about rheumatism. Now,
Yes.
in Africa, a lot of people call rheumatoid. When they say you have rheumatoid arthritis, the person say you have rheumatism.
Mm.
Now,
I really wish you can go on, but we're out of time, unfortunately. I'm so sorry.
all right, no
Yes.
problem.
Well, thank you so much. We do appreciate you for your time, and do have a wonderful day.
Yes, yes.
Thank you. And that will be it on Radio Doctor on WFM 91.7. Join us for another episode tomorrow morning at 10 a.m. Till then, I am Timmy Toke. Producer of this program is Esther Alaribe. Everything to her. Till tomorrow, do have a healthy day. Thank you for listening.